So the next speaker we have is Nancy Hodgson. She's the clinical nurse coordinator at Saskatchewan Bleeding Disorders Program. She started in the program in September 2008. She was the co-chair of the Western Nurses Group in 2010 to 2011. In 2011, she was awarded the Bayer European Nurses Scholarship and was fortunate to do training in Heidelberg, Germany at the Hemophilia Care Center there. In 2012, she was able to represent 2 poster abstracts accepted at World Federation in the meeting in Paris, France. She's a co-investigator on the CANAC research project using the Self-Report Verita Pro tool to identify adherence issues in adolescents and young adult males with hemophilia on prescribed prophylaxis. So Nancy, if you can please come up and give us your experience on implementation of the program.
Thank you. I'd like to thank the Planning Committee for the opportunity to share our experience in Saskatchewan on the implementation of CBDR. And disclosures, and yeah, I'm part of the STAG committee. So how did the implementation go at the Saskatchewan Center? There we go. It wasn't a quick process, and as I have been finding out, we should not complain. Our process has been a lot quicker than others so far. So, of course, it started off with the submission to the REB, and we did that in November of 2015. And actually, we got approval by May 2016, which apparently is fairly quick. I'm still inexperienced when it comes to research, so... but then we hit the privacy people, and that was a whole new ballgame, as we all know. And finally, at the end of June, we had approval. And we thought CBDR was ready to use. Well, some of us naive, inexperienced people thought. So then the next step was the CHARMS migration, and this is where we were in contact with Arun. We started with the phase 1 CHARMS migration, and that was where you would take your patient's information and transfer that over to CBDR. We had a few issues with that, so we had to do it twice. It turns out that our admin assistant prior used symbols and other little icons beside names, which we had no idea what that meant, and that it would make a big difference. And for her, it was if they had the star beside them, they were the actual patient. And if they had nothing beside, they were family. And if they had some other symbol, they had von Willebrands. It was just, so we didn't know this coding. We were naive. So, but we fixed that afterwards. And then the second phase, 2, of the migration, where all the previous treatment plans and treatments and bleeds that were attended to were inputted into CBDR. So in total, we had 13 months to finally get CHARMS going, which, as I said, apparently is not that bad. So December of 2016, we had full access to CBDR and MyCBDR information. A lot of our patients had been in the virtual clinic with MyCBDR and would talk to us about it, but we really didn't know what they were talking about at the time. One of the things that we had discovered at that time was, okay, we're ready, set to go, but we could actually only put input on the patients that have consented into CBDR and MyCBDR. So fortunately, once we got the REB and the privacy approval, we started the consenting process as we saw patients at clinics so that we could kind of be prepared for our live date. So the next step that we had to do was training sessions. And I was very fortunate that my clinic supported me to go and be trained by Arun and the Hamilton group. So we started off with training nursing because nursing would be using this tool quite a bit. We sat down with the physio, social worker, our administrative staff, and physicians are yet to be trained. So you're not alone. So going live with CBDR, we decided that in January of this year that we'd start inputting in. And we started off with all our scanned informed consents that we would scan them into our patients' folders, if you will. and we would start documenting clinic visits. We also decided as a team that we needed to have a meeting and just figure out what it was for minimum data set we'd enter in there. And it also was to give us clarity on who was responsible for inputting what information. Would it be nursing? Would it be admin that would enter all the blood work? And then this meeting probably took about an hour and a half or so. We got through the demographics pages because we were like tearing this apart left, right, and center. So we didn't get far per se. So where are we now? Well, actually, after this meeting in June, we're having another meeting in regards to what it is that we figure as a clinic group we can enter into CBDR. So, how are CBDR and MyCBDR changing Saskatchewan's clinical practice? Where is this here? I'm going to talk about the MyCBDR portion first. So we're going to talk about what percentage of our home infusion patients are on MyCBDR, and actually it's impressive for us. We are a smaller clinic, but 84% of our patients that are on home infusion have taken over MyCBDR. There's 80% of them that still do paper, and unfortunately we do have 8% that still hand us nothing. And we're working on that, but they have bigger fish to fry in their life. So what has helped the uptake and satisfaction for the users of MyCBDR? Of course, the launch of the phone app. For a lot of our younger guys, this was a selling feature for them for sure. It was more convenient. They all have their phone with them, so it made sense. It also helped that they knew that clinics could finally see their infusions and the attachments they would attach into MyCBDR. We have one of our younger guys who he was using it almost like a blog, and it turned out around Halloween. He did his infusion, but he also showed his big candy haul on top of the table for us to see. So a couple months later, we finally got to see all that. Also, we were able to make use of the data that our patients put in, and we could kind of go over that information with them at our clinic visits. What percentage of those registered with MyCBDR are reporting all of their infusions? Well, we still have the issue, just like we had before with EasyLog, bulk entering. We have some of our patients that, just like rent, they may just sit down and do it once a month. Also, we're finding that some of our stock on hand for patients are inaccurate, and that was due to them being in the holding center. At that time, they were given just kind of a bulk number of vials with no lot number attached to use, so until we actually got on board. So we're trying to work that out now, and that's just in process. Also, we, as well as our patients, are still learning how to use and interpret MyCBDR and CBDR. So where are we? We're not sure quite. So how is MyCBDR changing our clinical practice? Positive. We're able to see infusions in real time, which is of benefit to the patient and us. We can review the infusions, the bleed locations at clinics, and have meaningful conversation about their treatment regimen. The graphs that are provided are wonderful, and for some of them, that just hits home. You talk to them and say, how many bleeds have you had in the last 6 months? And they don't know, and a wonderful graph comes up with all the color coding for them. Accountability is back for factor or responsible factor usage. I mean, when EasyLog left, we actually had a lot of them that were just kind of doing, I don't know what, really. We gave paper logs, but some of them didn't want to go back in time from going electronic to paper. So now I'm going to talk about CBDR, and what I ended up doing for this part, I actually sent out a survey to our clinic staff so that I can get our whole group's idea on how we are doing. So the first thing I asked them was, are you using CBDR? Which seems like a silly question, but as you can see here, 58% of us are using it sometimes, 14% never. And that would be maybe a physician. 14% most times, and 14% always. And I can guarantee the always is our admin assistant. So as a group, do we feel that we're using CBDR to its full potential? And yeah, no, we do not, 86% of us. And of course, our admin said we could do better. Have we experienced any problems with CBDR? And actually, yes, unfortunately, 71% have experienced problems. But the biggest problem, and this was consistent, I think, for all of us, is having to change the password every 28 days. I have a password vault on my phone, and I can't remember that password to get into that sometimes, so never mind throw another one at me. Also, sometimes there's internet issues where it seems like it's slow for logging into the program. Also, we've experienced difficulty making corrections because at this present time, we don't have the capability to delete or edit some information in certain categories. And I've been told that will change down the line. Also, some of the dialog boxes have limiting characters. And if you like to chart lots, like some of us nursing do, that limits us on what we can actually put in there. So what is our satisfaction level with CBDR? Well, 71 say it's good and bad, and 29% no change. Again, the physician was in that category. So the big thing is now for us, we can see our patient infusions. And because again, as I mentioned before, the only resource we had was EasyLog. And then when that was taken from us, there was really only paper if that was brought in. One of the other things that was brought up as an issue as it doesn't have the function that our clinic requires, which is A6 from CHARMS, which is the full review schedule. Our clinic relies on that heavily for doing review clinic visits with patients. So I'm not sure if anyone else uses that, but I'll be interested to hear. Also, it requires additional time and resources for us, just because we're learning, plus we have to use different systems to make up for what CBDR doesn't have at this moment. So how is CBDR changing our clinical practice? Well, we've yet to establish our clinical goals and use for the program. So really, it's difficult to know how it's going to change our clinical practice. I can say on a nursing point, it's increased our workload due to documenting and using more than one reporting system. In our clinic, we end up documenting in CHARMS, we end up documenting in CBDR, we have paper copies still, and now our health region's coming up with its own electronic record. So I'm making a better admin some days than an actual nurse. But that we hope will get better. And there's also uncertainty due to having to remember to get consent for CBDR when interacting with a patient. When you have a patient phone you and they've had a bleed or they're, someone that like with von Willebrands that you don't see that often, you get the full meal deal from them on the phone. You hang up the phone, you want to go input and you look and they haven't signed consent or done consent with you. And it just seems wrong to call them right back and say, hey, can I get consent? So that's one of the downsides. As in CHARMS, we never had to do consent. How is CBDR changing our clinical practice? Well, it's a little bit of mixed emotions. And honestly, it can be chaotic at times. For us, CHARMS came in right after having to do all the factor switches. So we're still on the wave of change. So I'm assuming it's coming down, which is great. And we're all ready to kind of move on with it. What advice do we have for those just starting to implement CBDR at their clinics? Patience, patience, patience. It's not going to happen overnight. We're not going to be there fully going in a month's time. Arun was saying 1 to 2 years even, which, okay. Another thing is to make a plan. Decide as a clinic team prior to implementing CBDR what is considered the team's priority to enter into there, and also what is valuable input into the CBDR for the team. Also set a go live date to input in CBDR, and we did that. Our live date was the beginning of January. Implement progression in stages, and then reevaluate as a team if you're ready to implement further. So take little bits of it here and there, get comfortable with using the system, and then try and maybe add some more on. Listen and learn from others' experiences. And I have one other thing that I was going to add, which I didn't add on there, is definitely any wishes that you want, for changes, implementations, contact the help desk or one of the CBDR stakeholders over there. And I mean, eventually that hopefully will get molded into the program for us. Thank you.
Thank you, Nancy. I know that we just started as well in January, and it's been a work in progress. But I think one of the biggest, most important thing to do when you're actually implementing the program is having a plan with your team and actually having the data set that you want to be inputting for each patient and make that decision prior to enrolling patients. And as the patients come through your clinic, you do it as a gradual process where you're actually consenting each patient through clinics, not actually going through a list and calling people, and actually doing it on an ongoing basis. And I think that's why it will take 1 to 2 years to actually have all your patients to come through clinic and then have repeats to then start using the system and using its utility. So thank you.